Okay, welcome everyone. We are here at the Innovators Mindset. I have Brian Fengler, who is the co-founder and CEO of a company called Evidence Care. Brian, thanks for doing this on short notice. Really appreciate it.
Yeah, absolutely. Happy to.
So we've been talking the last couple of weeks about innovators sort of seeing a problem and jumping in and trying to figure out a solution in a pretty quick turnaround. Talk about what you noticed out there, what Evidence Care does, and what you saw out in the marketplace.
Yeah, happy to. So, Evidence Care is a clinical decision support company. And what that means is we help take kind of volumes of information that are out there in the clinical space, distill it down so that we can present it and providers can take action on it at the point of care, which to us is, at the bedside in their clinical workflow, which today is in the EHR.
Yeah.
And so, we've sort of prided ourselves in one of our mission statements is, the fact that we're there when providers need us most. And so obviously the world has changed over the last month, and we had great roadmap for what we wanted to be doing over the next 3 to 6 months.
Yeah.
But about a month ago, we sat down and we said, if we don't do something for COVID, why do we exist as an organization? This is exactly
it's the most urgent need providers have had in the history of medicine, and you have to help out. Yeah,
exactly. And so we kind of split our team in half, had half of our team allocated towards working on the projects that we had in flight, and we took a small group of the rest of our team and focused on building a COVID solution. And they actually built a completely new application in 10 days, while concurrently myself and our content team, which is a team of nurses, distilled volumes of information on COVID treatment and built those into pathways that providers could use at the point of care.
Wow. Okay, so in 10 days, you built both the tech infrastructure and the content that would then come together to a solution.
Correct.
And talk to me about hurdles. Like, did you meet any obstacles, or I'm sure there were things along the road that were unexpected or challenging?
Hours in the day,
Yeah.
coffee. The team pulled together really well. We did fantastic. The interesting thing about the whole COVID crisis is actually the way that it's brought down barriers. And what I mean by that is, everybody in healthcare has been talking about interoperability for 5 years now. No progress has been made. More progress has been made in the last 30 days on interoperability than has been made in the last 5 years. And that's because everybody has now come together with a single mission of how do we get information into the hands of our clinicians to help them save lives. And so we're honored to be a part of multiple different groups that include some of the largest technology companies in the world, the big EHR vendors, the content curators who some folks would say are the big whales, the big competitors of Evidence Cares. All of those folks have come together and said, we're going to freely share content. We're going to get providers the content in the hands of the providers as fast as possible. And it's brought down all those barriers. So now everybody's working together and sharing in this mission of bringing it to the bedside.
Yeah, that's incredible. So tell me, who's using it now? Was there a breakthrough moment where you saw your work actually help providers and help patients?
Yeah, so we were, the first day that we launched it, we actually got more usage in 24 hours than we got over 6 months of some other pathways that we had previously launched.
Yeah.
And so we had actually made the decision a few months ago. Our original product, we started off as a web-based product that clinicians could access, a computer, tablet, phone. we realized over time, this really needs to be in their EHR workflow.
Yeah, just
so
where they are all the time,
Yeah.
coding and looking up things, and yeah.
That's right. Yep. The data shows they spend 52% of their day in the EHR and only 27% of their day face to face with their patients.
Right,
They're spending twice as much time in the EHR.
That's a whole nother issue, but
Yeah.
if you want to help them, that's where they are. Yeah.
That's right. So we had actually made the decision 3 months ago to sunset our web version as we focus exclusively on our EHR integrated version in Epic and Cerner. And the challenge that we faced was, implementation at a hospital, takes 30, 60, 90 days. And no hospital implementation team has any bandwidth right now to do any of that. In fact, many hospitals, that staff has been furloughed, so they can't even do those sorts of integrations. And so we had to go back to the drawing board and say, how could we execute on interoperable technology that could be launched within 2 hours at a hospital system? And we went back to Cerner, went back to Epic, and got their buy-in to say, yes, we support this, and we'll do this, and we'll launch this for free for our clients, and do it in a way that can be launched very quickly. And when we came back around to that, and we did this, we realized, wow, I mean, the massive need for COVID is 10 times bigger than the need for any other sorts of pathways, because it's such an acute condition, and there's such a lack of information that providers are confused. They don't know what to do.
Yeah.
They're getting the latest evidence from news and social media, just like everybody else.
Yeah.
And so they're at a loss as well to figure out what's the best way to manage this patient that's sitting in front of me.
So in 24 hours, you had this huge uptake. Tell me about the impact. Has it really helped people? Have you gotten good feedback on it?
Absolutely. So we're getting feedback from the Emergency Medicine Society folks. We're getting feedback from, we partnered with one of the organizations in urgent care, and getting feedback from those users. And so far, the feedback is phenomenal.
Yeah.
I would love to say that we had somebody, most of the feedback coming back is, this is great. This is a great tool. Thank you so much for doing this. This is breaking down volumes of information. What we don't have, which I would love, is, that somebody emailing us and saying, hey, this helped me save this patient, or, but haven't gotten any of that, but.
But just helping them know what to do and be able to process more quickly, treat more patients is really impactful, I think.
Absolutely.
Okay, and then quickly, talking about where you see this going. Like, I don't think we're going to go back to the old way of medicine. What does this look like? How do care pathways? What does evidence care do? Kind of going forward, if you have a vision for it.
Yeah. So going back to how this has kind of broke down barriers. So we're working with again, multiple organizations, multiple government-funded organizations that have been looking at, how do we bring interoperability, and they've been looking to do that for a while now. They're all now galvanized around COVID, and we're actually leading a group that's looking at emergency department, inpatients, and ICU pathways, and how can we come up with, this whole group is looking to us kind of to say, what is the clinical content that providers need at the point of care, and how can we build that in an interoperable fashion that we can then get the EHR vendors to agree to say, this is the consistent fashion that we're going to share this data, so that this can be utilized as a standard of care by all clinicians across the world for these.
So whatever emergency room you go in, you get the best care, and it's the standard, and everyone's delivering the same best care.
Yes. And then on the backside of that is then also linking it to the outcomes data that the federal government is already tracking right now as part of their collation of data of how many patients are presenting to emergency departments, what's the percentage of positives on those patients, what percentage of those patients are being admitted, and then even more granular data on how sick are those patients, are they likely to consume ventilator resources, et cetera, et cetera.
Yeah. Okay, excellent. Well, thanks for your efforts. I know it was a Herculean effort, 10 days of probably not a lot of sleep, but really impressive to get it out there in the marketplace where it can really help people. Brian, if people want to learn more, give the website out. Is it evident? What's the website?
Yeah. So Evidence.care is our marketing website.
Okay.
But if folks want to go directly to the pathways, it's covid19.evidence.care. We'll take them directly to the pathways.
Okay, great. Okay, Brian, thanks for doing this. Really appreciate all you're doing for the healthcare system.
Absolutely. Thank you so much, Vic.
Okay, okay.